Another step towards reopening today. Phase 3 started in Massachusetts. And to talk it through with us is Dr. Robert Duncan, an infectious disease physician at Lahey Hospital and Medical Center. Good to see you again. Thanks for being with us.
Nice to see you. Thanks.
So starting today, gyms, movie theaters, museums, casinos, they can all open. However, in Florida, Miami-Dade County rolled back similar openings, shutting down gyms, dining in. Should we be taking more caution here?
Yeah, I think we really have to be careful about this. I think that there's some sense to getting back to a more normal level of existence, but I think you still have to maintain the basics of keeping your distance, keeping a mask on, keeping careful hand hygiene, staying home if you're sick.
Really good point there, because there were a lot of examples across the country, also here this weekend, of people taking COVID precautions, but then it seemed there were a lot of examples of people ignoring distancing, not wearing face coverings. If there were infections locally this weekend, when might we see that reflected in data or even in hospital visits?
Yeah, I think the people are going to be showing up in the next week or two with illness. Hopefully not with hospitalizations, but that's what you'll be seeing eventually.
Okay, the next week or two. Let's shift gears a little bit here. Over the weekend, a group of more than 200 scientists around the world say they have evidence that COVID-19 can be transmitted airborne, so tiny particles staying in the air from an infected person, speaking, coughing, sneezing, all the things that we know. But how is this explanation different from what we have previously heard from WHO and CDC?
I think that information has gotten a lot of attention. I think the most of the evidence that they cite has been in the laboratory setting, some of it with induced laboratory distribution of virus, but not in the clinical setting. Okay. We have really not been seeing that kind of thing in clinical scenarios. And if you had that kind of airborne transmission, it would be more like measles or tuberculosis, where you'd see far more cases than we're seeing.
Can you just follow up quickly? Why is that an important distinction, that what they have seen in the lab may not translate to a clinical or everyday setting?
Because the virus that they detect by PCR testing, by these molecular tests looking for the virus particles, may detect virus which is not infectious, and may or may not have enough virus to cause an actual infection in somebody and override their immune response to a foreign object. Okay, so the distinction is important. What is the discussion right now at Lahey and other hospitals within your group as you watch what's happening in the rest of the country, these cases spiking? Do hospitals feel ready here? I think we are ready for a resurgence. We are certainly hoping not to see it, but I think we're prepared to see it because it's more likely to happen than not.
All right.
Some of the hospitals in Texas and Arizona and so on are really being inundated, and we're trying to avoid that. I think we really have to maintain our vigilance.
Okay, good advice. Dr. Duncan, thank you so much for your time. We really appreciate it.
Thank you.